What does your calcium score mean? Now, you should go through it with your doctor, but the basics are that calcium scores are measuring the amount of calcified cholesterol plaques on your heart arteries, your cardiac arteries, or in your arteries. And, you can still have cholesterol plaques that are not calcified yet. The calcification happens over time. But if you have a calcium score of 0, that's a good sign and it's considered low risk. And your doctor will still talk to you about prevention and making diet and lifestyle changes for the prevention of heart disease in the future. Now, if your score is between 1 to 100, that's still sort of in the low risk range, but your doctor will still talk to you about lifestyle changes. And depending on what your risk factors are and how high your cholesterol is, you may even discuss starting cholesterol medication. Now, obviously, there are a lot of natural ways to lower your cholesterol too. If your score is between 100 and 300 to 400, it depends on which guidelines you're looking at. But if it's between 100 to 300 to 400, that's considered moderate risk for heart disease. And then your doctor usually would talk to you about starting cholesterol medication. Now, obviously it's up to you. There are natural ways to lower your cholesterol, but this is a sign, if your calcium score is between 100 to 300 to 400, that you have some amount of calcified cholesterol plaques already. And so that's important information to have. Even if you think you're not going to take cholesterol medication, if it's recommended to you, this may incentivize you to make more changes to be healthier, in your diet, in your stress levels, exercise, sleep. This might, incentivize you to make more changes. And so that's one of the reasons to get it checked. Even if you are not going to start cholesterol medication, a lot of times the information itself can help you make healthier choices. And then if your score is over 300 to 400, that's considered high risk for cardiovascular disease. And then your doctor, again, would definitely talk to you about starting cholesterol medications, but the lifestyle changes are very important too, because you really want to work on prevention, things you can do by changing how you eat, how you sleep, your stress levels, exercise, not smoking if you smoke. All of those things help with the prevention of future heart disease as well. And so overall, the calcium score really just gives you more information about where you are as far as have you developed cholesterol plaques in your arteries that have calcified, so they've been there for some time.